The Rio Grande Valley is a vibrant region on an international border, with many natural, historic, and cultural resources. But the region does face challenges including poverty, high rates of obesity, and chronic disease. The Brownsville campus of UTHealth School of Public Health was founded with the goal of addressing these local health issues through epidemiological and intervention research. Since the beginning, the faculty, students, and staff have partnered with local organizations and individuals to lead epidemiologic and intervention research focused on Latino populations, specifically on the U.S.-Mexico border. Dr. Joseph McCormick, the campus's inaugural regional dean, along with Dr. Susan Fisher-Hawk, founded the Brownsville Regional School of Public Health in 2001, setting the stage for a thriving campus.
Since January of 2001, the faculty of the UTHealth School of Public Health have been committed to providing high-quality public health graduate education to the residents of the lower Rio Grande Valley, as well as to national and international students. Our beautiful Brownsville campus pairs exceptional classroom experience with critical fieldwork, providing the context and realities of working with communities with limited access to health resources, education, and finances, but that also display resiliency and strength in overcoming those barriers. Guided by expert faculty and experienced staff, students are expected to build relationships with local organizations to develop common goals and achieve change and sustainability together. Our students are expected to join multidisciplinary research projects that investigate and improve chronic and infectious illnesses. Our collaborative action board gives us direct connection to multi-sector partners across the region who, working together, are solving the most pressing health challenges.
We first came here, we had no idea what we were going to do. So we kind of looked around and there was no Ebola. So we said, well, we're not going to do that, are we? So we said, what are we going to do? So we said then the best thing to do is to figure out what are the main problems here and see how we can apply our expertise to these particular problems.
The first thing we did was to go to meetings held by the city, actually, at that time. This was sort of the Healthy Communities program, and listened. Just listen. What are the issues here? What are the problems? What do we need to think about that are important for this community? Because it made no sense for us to come here and think we're going to do what we've been doing before. First of all, there were no laboratories here, so that was never going to work. So that's what we did, and we realized that chronic disease was a huge issue, and even more that the issues around obesity and diabetes were really the key issues in terms of driving the health and the health disparities of this community. And it was clear from our meetings and from going around that this was not necessarily the perception of the local population, that obesity and diabetes were more considered to be kind of, it's just part of who we are, rather than this is something we can do something about. I'm very proud of the fact that we set up and got a grant from the NIH early on to start a whole range of programs. And the purpose of that was to answer the question we couldn't answer was, how much disease do we have? The only way we could figure that out was to have a cohort of people that we selected randomly from the community, bring in and measure what their obesity, their diabetes, all the things that we could measure to understand what was the burden of disease as we defined it. So I'm very proud of that. But that grant also, think about it, started the Tu Salud Cincuenta program was funded by that and started by that. And that grant also established our advisory board, our community advisory board. All of that came out of that grant. So I'm very proud of that because it really got us started. We have tremendous collaborations now across the country, and that's because of our cohort and just because of the time. We're starting our 20th year here, and so I'm very proud of all of these things.
As a student, I've had the unique opportunity to work closely with our faculty on research topics such as the association between chronic diseases and infectious diseases with diabetes. Our findings contribute in meaningful ways to public health actions taken by our community. I've also been able to engage my leadership skills with our Graduate Student Association and connect with my peers here and across our 5 campuses in Texas.
I work on the fields of microbiology, which is the study of bugs, and the field of epidemiology, which is the distribution of disease in a community. And the bug that I work with is called Mycobacterium tuberculosis. It is the etiological agent of pulmonary tuberculosis. This is a very serious infection. It causes millions of deaths each year. It's the #1 bacterial killer worldwide. Something unique about our School of Public Health is that it's located on the border on Texas and Mexico. And so I work with public health officials in TB clinics on both sides of the border. So we comprise interdisciplinary teams of scientists like me, plus public health officials on both sides of the border. Perhaps our major discovery or gift to the world to date is the discovery of the reemerging importance of diabetes as a risk factor for tuberculosis.
Going through the Masters in Public Health program has changed my vision about my role as Public Health Director for the City of Brownsville and the trajectory of my career. Working together through the Collaborative Action Board with faculty and staff from the Brownsville campus has allowed me to build capacity and expand the impact of my department to improve the health of our community through policy, the built environment, community health, and sound decisions around infectious diseases like H1N1, Zika, and COVID-19. Our collaboration won us the Robert Wood Johnson Foundation Prize and allowed me to become an RWJF Fellow, opening doors and opportunities for my career and for the city of Brownsville.
Sue and I have worked all over the world in so many different cultures and settings, and it's the people here and their willingness to help their community. They are kind, they're hardworking, they listen, they learn, they believe in what they do. We couldn't ask for more than that. So all of those things we find terrific about the Valley.
The UTHealth School of Public Health in Brownsville has brought millions of dollars to the region, created hundreds of jobs, and partnered with dozens of counties, cities, and communities across the Rio Grande Valley. We don't do this alone, but we do bring leadership, resources, and expertise to address health concerns unique to the Rio Grande Valley. Our research is relevant and leads to visible, tangible change in our neighborhoods, schools, clinics, and communities.